Hello, Patient Congress. Now, I'm not exactly sure when this video is going to be aired, so good morning / afternoon / evening, and the often overlooked good noon, okay, in case this happens to be right on the... My name is Ben Brown. I, 4 years ago, was honored to have been bestowed with the Monica Bales Award from U.S. Oncology, as I was to begin my training at the University of Texas Southwestern Medical Center in Dallas, Texas. Now, 4 very, very long years later, I've completed. My time as a student has come to a close. And now, while that may sound to you like, oh, woohoo, his time as a student has come to a close, like, let me give you a little perspective as to how that, came about. When I was, let's see, 3 years old, in 1985, I started preschool, okay? Between then and now, I've pretty much just been a student, okay? So, a lot of fun. So, but none of that could have prepared me for the kind of responsibility and the kind of environment that comes in medical school. Okay, now, so for those of you who maybe aren't too familiar with the medical education system, let's just take a second. Let me tell you how it kind of works, okay? So I did my 4 years of undergraduate work, and then after that, I started at medical school. Now, it's a 4-year program. Typically, in America, it's a 4-year program. And it's very structured, very structured. The first 2 years are going to be more classroom-based, okay? A lot of book learning. The third year is a very intensive year on the hospital ward, seeing patients and interacting with doctors. And the fourth and final year, which I've just completed, is a strange mix of electives, time for the residency application process, and a ridiculous amount of free time. Now, let me just take a second. Let's pause. Because I know I've been to Patient Congress before, and I recognize that while you're watching this video, you have either already finished eating, are in the middle of eating, or are about to eat. So I know that you can kind of be zoning out right now, kind of get the, the food going. I feel you. So in case you are one of those people who have already zoned out and have no idea what I'm talking about, you just blanked out, which is fine, it happens. I would like to kind of take a second and present what I like to call a dramatic reenactment of medical school in 4 acts. Okay? So let's start. Here we go. Act 1. Okay, sir. So we have a 34-year-old white male with cirrhosis, hyperlipidemia, coronary artery disease, hepatitis A, B, C, D, E, and L. Hadn't heard of that one until I Wikipedia'd it. And a history of cocaine abuse, who presents with chest pain, nausea, and constipation over in the ER. And you want me to go stick my finger where? Hey. And scene. Thank you. Thank you. Thank you. DVDs will be on sale in the lobby next to the Wintley Phipps CDs. All right. So, all joking aside, what I was able to do was use my 4th year to sort of expand my horizons, shall we say. I took on a lead teaching role in the Human Anatomy department, for which I was awarded UT Southwestern's highest honor for teaching. I've also spent time volunteering with helicopter paramedic teams around Dallas. But the absolute highlight, maybe of my life, came from spending a month working in Africa, specifically in the country of Ghana, focused mainly around the capital city of Accra. Now, if I'm going to talk about my time in Africa, I need to kind of prepare myself, get into the Africa mindset, get back there. So hold on 1 second. Okay, now let me start by saying I did not purchase this shirt. Okay, this shirt was given to me as a gift from the people of Ghana. Okay, I would not personally spend money on a shirt of this quality. Okay, now no offense to anybody in the audience who may or may not own a similar shirt. I'm sure you look super cool. No problem. A classmate and I orchestrated a month for ourselves, working in several schools and orphanages around the city of Accra, as well as creating and running makeshift clinics around the community itself. And it was absolutely incredible. The children I worked with became an absolute part of my life, and I still carry every one of them with me in my heart. In my spare time, I teach classes for the kids on anything from first aid to a balanced diet to basic hygiene. So this was, without a doubt, the greatest part of the trip. Let me tell you one of my favorite stories. I was teaching one day, and it was a class of smaller children, and it was about first aid. And they'd ask me all sorts of different questions about if I get cut, what should I do? And we'd always say, first thing you do is wash it. And then they'd say, well, what happens if, I cut my knee? First thing you do is wash it. What happens if I cut my shoulder? And there's just a lot of questions like that. And so then we broke and we went to recess. And the kids were all running around playing, and then 3 of the little boys who were in that class came up to me, and one of them had an old cut on his leg and wanted to know if there was something that I could do for it. And so I looked at them and said, well, guys, what's the first thing that we do? And all 3 of these little African boys just went, wash it! And they ran off to the faucets to wash their legs, And while we were there, we were giving out medicines, we were setting up clinics, we were doing all sorts of things that I have no preconceptions that as soon as we left, the sustainability just was shot, and they more than likely fell apart. But to me, spending an hour talking to those kids about washing after an injury, that's permanent, that's forever, and I love it. It was incredible time. So, all that to say, I've gotten the chance to be a part of so many wonderful things over the past 4 years, and just as integral a part of my educational experience was the Patient Advocate Foundation. When I was an 18-year-old college freshman, I was diagnosed with stage 3 Hodgkin's lymphoma, and immediately I was deluged by advice from doctors and family who thought that me staying in school and taking a full course load during treatments would be out of the question. I simply maintained that they were asking the wrong question. While they were concerned with how to keep me from dying, I was more concerned with how to keep living. Because of my age and the type of cancer that I had, death was never a real concern for me. So my battle with cancer became not one for survival, but rather to not allow it to dictate where my life was going to go. That was my struggle, my journey. So I stayed in college, taking a full course load, never missing a class, and commuting over 200 miles per day for chemo and radiation treatments in Dallas. And the day that I walked across that stage to graduate with my class, I knew exactly what God wanted for me. To use my experiences and my insight into the patient mind to help those who need it the most, whether it's in an African slum or at the cancer ward down the street from me. And it was here that the Patient Advocate Foundation became such an incredible part of my life. And not just in assuring that my medical education was within my financial reach, but in year after year, showing me that we have a responsibility to the person sitting next to us. That lessons learned and battles fought on the Senate floor are just as important to a patient's health and well-being as those learned in a hospital room. Nancy, Ruth Ann, everyone on that staff, they're fighting for a better future. You, by being here, are fighting for a better future. And from those of us who are on the front lines of our nation's healthcare system, you have no idea how much you're doing. You have no idea how much you're needed right now. So, what's next for me? On May 31st, I was awarded my doctorate from UT Southwestern, and now, as Dr. Benton Brown, I'll be starting my residency here in Dallas in general surgery, which is sadly why I'm unable to be with you all this week. But as I start this new chapter in my life, I look forward to practicing medicine while keeping in the forefront of my mind the lessons that I've learned, both from the Patient Advocate Foundation and from my own cancer story, turning what could have been tragedy into so much more. So that, in the end, my weakness becomes my strength. My pain becomes another's healing. And with your help, I look forward to working in a future that's better and brighter for all of us. Thank you so very much. God bless.